here. Three of us on the stage here had nothing to do with healthcare. We met at a conference at the same site about a year ago, Morteza and I, on industrial automation. Morteza did his dissertation around additive manufacturing, 3D nanoprinting for stretchable sensors. And the rest of the team here, myself and Kyle, we were working down the road in Maple Heights, and we said, wouldn't it be cool if we take this technology and apply it somewhere that's meaningful? Of course, 3D printing technology is a buzzword, but Morteza and his team has really created an amazing nano printing capability. So this concept around IQ Sensor was actually dreamt up in a hot tub with my wife. She's a nurse of 15 years, transplant nurse, and she said, well, we were brainstorming ideas on how to use stretchable sensors, and she said, well, why don't you try and measure someone's blood pressure with a stretchable sensor where they could wear it, and that would provide a lot of value. So we showed up today, we showed up yesterday. We had a respiratory therapist, a biomedical engineering team, and we created a prototype to do this. So first off, we wanted to start down the path of what the value is, and there's lots of value of measuring anything stretchable on a patient. We got great feedback from all the mentors and all the physicians in the room and doctor nurses. But one thing we honed in on is enabling control for physicians and for patients. And the concept here is that the doctor prescribes a blood pressure medication to the patient, and the physicians really want to monitor the impact of that medication and make decisions backed by data, and really tailor the care plan to their particular patient. And empowering patients through data leads to more holistic well-being. We're seeing this in the fact that I got my 10,000 steps in today, that leads to weight loss. So we think there's some value there if we let the patient share data through real-time blood pressure monitoring, through 24/7, 365. The other one was reducing costs, so streamlining prescription drug plans. The general consensus of the last couple of days talking with some industry experts, which we are not, but thank you for putting a lot of industry experts in the room, that when someone prescribes take 5 pills a day, they might not need those 5 pills for blood pressure medication, but it's sort of a general rule of thumb. They might need 2 on a Monday, they might need 4 on a Thursday, depending on how physically fit their activity they're doing. Well, if you're monitoring blood pressure in the time, you could actively make better, more educated decisions and essentially save money for drug plans. And when you have an incorrect dosage issue, more side effects come up, and then you have to prescribe drugs for drugs. And then readmission rates, we think that using this type of monitoring solution could reduce readmission rates, which is a big penalty not only for Medicare and Medicaid patients, but also just hospitals in general who do not want to admit. So we think we can impact quite a bit of patients here. We did some research and said 2 out of the top 5 most prescribed drugs are blood pressure medications, and about 15% of Americans are patients. That's about 45 million people. So if we could strap some type of wearable that monitors blood pressure in a very cost-effective way, we could have 4.4 million, even just 10% of the total available market for this. We could have 4.5 million strapped-up sensor people. So looking at the market on the business side, so I got to put the slide in. 1 in 5 Americans own a wearable, 1 in 10 actually wear them. And we think we could sell a band for $99, and there's quite a big potential here. All what we call in our business hockey stick math. Everything scales, just get the volume. And we think we can make it for about $10. So what our design here was, and you guys seen us soldering. We strapped Morteza's Printable 3D sensor, which we created beforehand. We put in some chipsets. That data goes to the cloud, goes back down to the phone. We get real-time measurements. Then the patient acknowledges that they've taken their medication, and it goes back through Validic to the provider. So just some videos here of it actually we're running here. Is the second video? First one is okay. So our model here, Kyle, is actually wearing the device. We got it wired up with 12-volt batteries. it's sending data from the strength sensor, and we're getting real-time data and apply back to the phone. So it goes through with a product called Photon that connects it to the cloud, and we use the ZRF getting real-time trend data. So yeah, it's a great experience, and we really hope you. We really want to win.